Welcome, everybody. Good morning, good afternoon, or good evening, depending on where you are joining us from in the world. My name is Chimama Mlongwa, and I am a young leader from Malawi. I am the team leader for She Decides Malawi. I want to say thank you for joining us for this concurrent session room on nurturing care framework and delivery methods in fragile settings. Concurrent sessions bring together diverse professionals, experiences, perspectives, and examine how new research, evidence, and strategies can help in our practices. We encourage you all to actively participate, ask questions, and share ideas with our presenters. Please use the chat bot to type in your questions and comments during the presentations. If time allows us, we may be able to pass around the microphone to a few people after each session. So our speakers are Tom Davis from World Vision International, who will kick off this room session. Tom is the Global Sector Lead for Health and Nutrition at World Vision International, who will be followed by Bernadette Dalemans from World Health Organization. She is the coordinator of policy, planning, and programs at the Department of Maternal, Newborn, Child, and Adolescent Health. I will now hand over to Tom, who will be presenting on scaling the nurturing care framework using care groups. Over to you, Tom.
Thanks so much. I appreciate it. And welcome to everyone. We're glad we're here. We're going to go ahead and jump in because we have quite a limited session, but we think we can give you a good idea of what we're working with here. So the project model we'll be talking about today is a multi-sectoral version of the care group approach, which we're calling nurturing care groups. And we actually encourage you to use that same name as well. This particular model is used to promote behaviors associated with most elements of the nurturing care framework, which was released by WHO and UNICEF and other partners in 2019. And the purpose of this model is to promote basic parenting skills and adoption of key behaviors from most sectors, not just health, nutrition, and WASH, where care groups have traditionally been used, but also child protection and early child education, where it has been used a lot less often, and possibly also caregiver mental health. The nurturing care framework promotes many things which all of us have already been promoting, like good health and adequate nutrition in particular, but it brings in more of the Thrive agenda by focusing on opportunities for early learning, security and safety, and responsive caregiving. This was important to us since we know that we need to work further back in that chain of causation of child deaths and better address some neglected issues to improve child well-being. For example, we need to focus more on security and safety by reducing violence against children and reducing child injuries. And in particular, we need to reduce harsh punishment of children and child marriage, since a 10% reduction in child marriage can contribute to a 70% reduction in the maternal mortality rate. We also need to improve adolescent nutrition, which of course affects low birth weight and prematurity, the leading cause of newborn deaths. We also need to focus more on the other parts of the nurturing care framework, such as opportunities for early learning and responsive caregiving, by increasing early child stimulation and improving caregiver mental health. World Vision's new health and nutrition sector approach gives more attention to all of these issues. And you may have heard about Food for the Hungry and World Vision's RCT on caregiver mental health. We're presenting on that tomorrow. But the headline from that study was that adding a mental health intervention to care groups achieved a 95% reduction in depression in both the treatment and the control group. And non-depressed women had adoption rates of key health, nutrition, and WASH behaviors that were almost 40 percentage points higher than that of depressed mothers after the IPTG treatment and before behaviors were promoted with care groups. Also note that in the Nurturing Care Group Training Manual, we give the option for working with almost every household in a community, such as households with children 0 to 18 years of age, or a more targeted approach, such as households with pregnant women and children under 5. The early World Relief Gaza Care Group project that had outstanding sustainability reached almost every household. And that approach also allows you to talk about issues that affect older age groups, such as adolescent nutrition, childhood injuries, menstrual hygiene, etc. We also have guidance on how to work with faith leaders who were organized into their own care groups as an option, in the same way that was done by World Relief in that early care group project in Mozambique. With this project model, field offices can prioritize about 10 2 to 3 month long modules with about 4 to 6 behaviors promoted per module, from WASH, health and nutrition, education, and child protection. So this 48 to 72 lesson curricula could then be taught over a 24 to 36 month period. And while a shorter list of key messages or lessons for each sector are recommended in the training manual, all of our field offices are encouraged to promote at least 4 lessons from each sector when using the model to make it truly holistic. And our offices have the freedom to choose those behaviors to promote that fit with their given context. And they wouldn't normally use all of the lessons in this full list of lessons that you'll hear about today, but instead tailor their list to particular regions or group of communities' needs based on baseline assessments. Lately, Henry Perry and I have discussed this a lot, and in general, we believe that if we want to scale up the nurturing care framework and the Thrive agenda, we need to have more and more countries using 2 tiers of community health workers. The current tier, who often work a few days a week or full-time, and eventually they should all be paid. And a second tier of volunteer community health workers who can focus mostly on behavior change with limited hours, about 8 hours a week or less, like nurturing care group volunteers would be doing. Without these 2 tiers, we don't see how we can address all of the things that we need to address with the nurturing care framework and beyond it without severely overloading community health workers. So our panelists today, I'd like to ask them to turn on their videos and wave when their name is called. Or Victoria Sargsyan, who is World Vision International's Technical Advisor for Education. Paul Stevenson, who is World Vision International's Technical Director for Child Protection and Participation. Cynthia Fasawa, who is the SBC Specialist for World Vision Ghana and is participating in one of our first uses of this model. And also Adunia Kebede is here. He's WBI's Technical Director for Health and Nutrition. Adunia is not presenting today, but he's online and was very involved in the creation of this model and is also a co-pioneer of the care group approach. So now I'll turn over to Vika to tell you a bit about the education and, the opportunities for early learning side of this.
Thank you very much, Tom, for the introduction. Can you hear me well?
Yes, very well. Thank you.
Can I also ask that you click on the next, because there is no need for, thank you so much. So in the next few minutes, I will introduce you to the early childhood development lessons that are mainly focused on the early learning and responsive caregiving domains of the nurturing care framework. But they also reinforce the behaviors from health, nutrition, WASH, protection sectors. As a behavior change model, each nurturing care group lesson focuses on few key behaviors, and as Tom said, that caregivers learn and commit to practice those at home. And at the next lesson, they share their successes and challenges. For the ECD nurturing care group lessons, World Vision's evidence-based model called Go Baby Go served as a basis. The main objectives of ECD nurturing care group lessons are to help caregivers, first of all, to understand that child well-being depends on multiple practices and gain skills to provide holistic care in all 5 domains of the nurturing care framework. They learn that all 5 domains are interlinked and they amplify the effect of each domain when practiced in an integrated manner. Caregivers are reminded also of some key health nutrition practices, such as visiting the clinic for growth monitoring, immunization, and are introduced to foundational family practices for early learning, responsive caregiving, and protection. The following lessons deepen the caregiver's understanding and help them gain skills to promote child development in physical, social, emotional, cognitive, and language domains. The lessons stress the fact that developmental areas are interlinked and affect each other, hindering or reinforcing the overall development. The lesson activities help to demonstrate how daily childcare practices such as hand washing, bathing, feeding, or even the home chores such as cooking, cleaning, or gardening can turn into opportunities to promote holistic child development. For promotion of early learning, caregivers learn practices that promote each area of child development, such as physical, social, emotional, or cognitive. But again, we demonstrate how domain-specific activities can promote multiple areas of development at the same time. The examples of early learning are such as talking, reading, singing, playing, pretend play, or toy creation, etc. The responsive caregiving is the main focus of the ECD lessons. We have 2 lessons specifically devoted to promote responsive caregiving practices such as serve and return interaction, secure attachment, responding to child needs immediately in a warm, affectionate way, and protecting them from harmful stress. However, responsive caregiving is integrated into all sessions, and it's because it's central for all nurturing care practices and domains that are health, nutrition, protection, early learning. The caregivers also understand the importance of caregiver mental health and well-being and gain some skills for self-care activities. 2 of the ECD lessons focus on creating simulating home environments, promoting practices such as home safety, hygiene, inside and outside the home, where children spend most of the time for playing, eating, or exploring. The considerations when promoting the early learning opportunities through nurturing care group is that we acknowledge the fact that ECD is a multi-sector effort and cannot succeed and be sustained without peer sector support and cooperation. Therefore, leveraging on other nurturing care group lessons, such as for health, nutrition, child protection, as well as integrating those lessons into other models, interventions for the most vulnerable, using the livelihood, WASH, malnutrition, or mental health platforms is very important. At this point, the ECD lessons are not yet tested, but we're looking for opportunities for implementing and also evidence building on these lessons, especially in fragile emergency contexts where ECD is essential but under prioritized. Thank you so much.
Thank you, Vika. And now we'll pass over to Paul to talk a bit about child protection.
Yes, I'm going to talk about the lessons to promote child protection and safety and security. The child protection lessons contribute to the safety and security and also the responsive caregiving components within the nurturing care framework. There are 15 lessons and they cover a range of behavioral objectives focused on shifting behaviors that enable people to recognize and report up violence and become aware of the impact of violence on children and their development, and also understand the benefits to their children of practicing non-violence in the household. I've listed there the numbers of lessons against the different objectives, but the majority of the lessons encourage behaviors that improve communication, relationships, and understanding between caregivers and their children, with a focus on adolescents especially, and with a real focus there with regards to their mental and sexual reproductive health. They contain practical and actionable messages around positive parenting and alternatives to corporal punishment, as well as addressing harmful practices such as early marriage and child labor, as mentioned by Tom earlier. Caregiver well-being is also addressed in the lessons, and one lesson focuses specifically on decreasing caregiver stress. There are energizers and activities in other lessons that also provide caregivers with techniques to relax and care for themselves. Together, the lessons provide a holistic and coherent set of messages that can foster a culture of peace, nurture and care in the home, but also influence and shape community behaviors to prevent violence against children. Also, a version of these lessons have been developed for savings groups. They encourage savings groups members to practice behaviors which strengthen the protective environment for children in their communities, as well as budget for child well-being and prevent exploitation of children as a result of any increased economic activity in the household. The messages align with global efforts to end violence against children as articulated by the WHO INSPIRE framework, and also, as mentioned before, to the Nurturing Care framework. Now, other considerations when promoting safety and security and child protection through these lessons. Well, children's safety, security, and protection is everybody's business. The child protection lessons can be introduced alongside health and nutrition, WASH, and early childhood lessons. They complement and enhance holistic child well-being outcomes through preventing the negative impacts of violence on children at an early age. The lessons should be implemented within the context of a broader systems approach to prevent and response to violence against children, including strengthening services and support mechanisms, laws and accountability, and empowering children and adolescents with life and protective skills. These lessons can be used to strengthen the informal mechanisms within a child protection system that prevent violence against children. And as Vika mentioned, these lessons too are recently drafted. We are still looking to learn more about their implementation in different contexts. There has been an initial piloting of these in Ghana, and we're looking forward to seeing the results of that. And that's it from me. Over to you, Tom.
Thanks, Paul. And as you're hearing, we do have these lessons to what is promoted through this model. And by the way, you can always look at caregroupinfo.org if for some reason you haven't heard about this behavior change model before. We don't go into that. But then there are other services that we see that should be provided around this model, such as creating child protection committees, for example, that can really help you achieve even more results. I'll pass now to Cynthia to talk about WASH.
By especially providing clean mats for children such that it will reduce the risk of exposure to household infection.
Sorry, we're in the middle. You can't raise the volume from this end, only from your end. The volume is a bit low. But let me just speak through this slide then very quickly since we're running out of time. So basically, with this particular, with WASH, it's not very different from a lot of what we've been promoting in WASH with care groups in the past, but there is more attention to empowering caregivers to provide a play space for children, the clean mat to reduce risk of exposure to household infection, safer management of animal waste, all those things that appear to be linked somewhat with stunting, proper disposal of child feces, having a clean compound. There's also a whole section, 2 lessons on knowledge and capacity in menstrual hygiene management, which we haven't seen used as much, and having that supportive environment for women and girls to manage menstruation with dignity. Also, a section on access to safe water, point of collection, and during transportation to use, sanitation and hygiene, like hand washing with soap, and keeping food safe and clean. And then in terms of the opportunity, the considerations when promoting this is it can be combined with other models like CLTS, IBM for WASH, using formative research like barrier analysis. And we need to encourage local ownership of nurturing care group volunteers and using Ministry of Health-linked community health workers as the promoters when you're using this model. So thanks to Micah, Paul, and Cynthia. And so in addition to modules in these areas, we do have NCG lessons we're developing for health and nutrition. Those will have several non-traditional health and nutrition lessons that will focus on older children like adolescent nutrition, especially anemia, reducing child injuries like drowning and burns and snake bite, and talking to children about substance abuse. And as a reminder, all of these lessons will be available to core group members soon. So that's it for now. We only have a couple, 2 or 3 minutes, unfortunately, due to the little bit later start than we expected and then having the audio problems in the middle. But we can take any questions you have. If you were not that big of a group, I don't know if someone wants to raise their hand. Let's see. Yeah, why don't we just have you raise your hand if you'd like to ask a question, and I can call on you. Okay, I don't see any questions coming in. And one question we had for you as well was, what do you foresee? Do you foresee your organization using some of these lessons when you're doing care group projects? And if so, kind of what do you see as the challenges or benefits of using these? Phil, your mic is open. You want to ask a question or make a comment?
No, sorry.
Oh. There's a hand raise button over there on the right, or you can just open your microphone since we have a pretty quiet crowd today.
I do have a clarifying question, Tom.
Okay.
Could you please clarify about, if it hasn't been said before, what is the target age group of children that you would want to reach through these nurturing care groups?
Well, with the nurturing care framework, we're often talking, 0 to 5, 0 to 8, and I'm sure that will come up in the next presentation following this. And so we've actually, when we proposed this to our field folks, they said, really, we want to reach almost every household. Part of that was based on the World Relief Gaza experience, where they go back at 3 and 5 years after the end of a project, and the volunteers, 90% of them or more, were still using the model. We think it really helps with sustainability. And also because then you can get into some of the adolescent behaviors. And so often it'd be like households with kids 0 to 18, and that's a huge proportion of them. Other questions? Yes, Claire?
Hi, Tom. Thanks for the excellent presentations to this group. It's Claire Hanbury, Children for Health. I'm wondering if these lessons are being used with adolescents as the caregivers, because as we know, children and young adolescents do a lot of caregiving themselves. And I just wondered what your experience of that was, or indeed any insights you might have around that. Thanks. Yes,
actually, with our new health and nutrition sector approach, we pointed out strongly that about 25% of these caregivers are adolescents, and then they're younger than 18, so that we should definitely be reaching them. And they can be reached with most of these lessons, but then also some of the adolescents' particular needs, like especially anemia, even if they're not caregivers yet, that we want to be talking to them about those lessons and promoting what they and their family can be doing. Okay, maybe one other question. We're right at the half hour.
I have a question.
Yes, Monica?
Yeah, I wanted to know, based on addressing the different domains to this model, nurturing care model, I wanted to know, for example, if clients, especially caregivers, were being taken through this process just for them to be empowered. What is the timelines? For example, going through all the domains, especially for the early childhood, and the other component of WASH, the safety. So the overall framework, how long would that take?
Yeah, if you were to use every single lesson that we're going to create, it would take about 24 to 36 months, about 2 to 3 years, with either a home visit or a group meeting. You could do either one every 2 weeks. That's kind of how care groups operate. However, sometimes you'll do your baseline and say, well, these particular behaviors, we're already seeing 80, 90% of people adopting them. So they might drop those and just mention them briefly and focus on the ones where adoption is lower. Okay, unfortunately, we are out of time, so I will pass back to our capable moderator. Thank you very much.
So before I hand over to the second presenter, if you could also turn your mic so that we could just give the World Vision team a round of applause. Thank you so much.
Since we're losing Chimwewe's audio, I don't know if Bernadette is on and could just take over.
Actually, this is Katie Murphy from the International Rescue Committee. I'm going to kick us off. Hello, everyone. Thank you, World Vision, for those excellent presentations. As I mentioned, my name is Katie Murphy. I'm the Senior Technical Advisor for Early Childhood Development at the International Rescue Committee. We're delighted to be joining this really important panel today, and thank you all for taking the time. As highlighted by our colleagues in the previous panel, we see nurturing care as really critical for achieving our global health ambitions, not only our global health ambitions, but of course the Sustainable Development Goals. We see nurturing care as critical for reducing inequalities and for ensuring that all children have the opportunity to survive, thrive, and prosper. And of course, these essential components of nurturing care, which are highlighted on the screen, good health, adequate nutrition, responsive caregiving, safety and security, and opportunities for early learning are necessary requirements for all children, but particularly for those who are living in situations of adversity. And we know for nearly 30 million children who are born in situations of crisis and conflict on a yearly basis, that those children in particular need the nurturing care interventions to be able to build resilience and to recover from the types of adversity that they face. The objective of this session is to, in addition to underscoring the critical needs of children living in conditions of conflict and crisis, is also to highlight some actions that we all can take to minimize the impacts of adversity in fragile settings. And then as really a call to action for all of us who are part of this cause and listening to this session to really increase our commitment for nurturing care interventions in humanitarian and fragile settings. With that, I will hand it over. The way that we've organized our session, we will have two very quick spark talks. One from Aya Yunus, who is our ECD Regional Human-Centered Designer at the International Rescue Committee Airbel Center, working on the Simpson project. Maria Paula Reinbold, who actually, will go before Aya, who is the ECD specialist with the UNICEF Regional Office in Latin America. And then we will move to Sheila Manji from the World Health Organization for some questions around the implementation of nurturing care and some of the resources that will be useful for practitioners interested in this. Before we open it up for questions from you all. So as you're listening, please think of your questions, and we hope to have some time for interactive participation at the end. So with that, I will hand it to Maria Paula, and hopefully the slides are working well. And you can turn on your video. Okay, we can switch the order then, maybe give Maria Paula a few more minutes to join and go to Aya. Aya, are you ready?
Yes, I am.
Okay.
Hi, everyone. This is Aya Yunus from Simpson, a groundbreaking humanitarian program between Sesame Workshop and the International Rescue Committee, IRC. The two organizations actually had a bold desire to reshape how humanitarian aid responds to or serves children under the age of 8. While meeting the immediate needs of refugees and host communities is existential, but yet it's not enough for them to recover and thrive. Research actually shows that they need the skills to mitigate the negative impacts of living and enduring a crisis. Hence, Simpson works in the Syrian response region and targets children and caregivers. Simpson draws its models from the nurturing care framework, and it works across a spectrum of intervention intensity, layers of enabling environment, and as I mentioned, targets children and caregivers. In its first model, which is the most universal approach, we have mass media, which is led by Sesame Workshop, who produced an all-new TV show in Arabic about social emotional learning, and it's being broadcasted on several TV stations in the region. Additionally, Simpson delivers its services directly through IRC existing platforms. So we integrate with women empowerment, child protection services. We have home-based visits, group sessions at centers, and also in light of COVID, we're offering our services through remotely through the phone. And lastly, we work to influence practice and policy, because our ultimate objective is to create models that are scalable and easy to replicate in other fragile contexts, if I may use the same title of the session. And for one of these projects that we've been working on in the past year is integrating Ahlan Simpson, or actually leveraging the health system to promote early childhood development practices among caregivers. And the reason to choosing the health is because of its high prevalence to caregivers and children who are in our target group. We've used innovation tools, hence like human-centered design and other, to identify opportunities and constraints that lie within the health system. We design solutions, we prototype these solutions at IRC clinics in Jordan, and now we're working with the Ministry of Health in Jordan to integrate these solutions with their systems. The three solutions that we're looking at are, one is called Ahlan Simpson Ambassador Program, which looks at building the capacity of midwives and nurses to become paraprofessional parenting counselors. Secondly, we're looking at building and installing playful learning areas that are hands-off, minds and hearts on for children to engage as they wait for their turn in the health centers. And lastly is producing these snackable publications that are very targeted, age-targeted, and also promote very practical and simple tips for caregivers to implement at their homes with their children. We're currently in the prototyping phase, as I mentioned, and we're looking to replicating these models in the other countries that Ahlan Simpson is serving, and hopefully have a legacy of a model that could be used in other countries. Thank you.
Great, thank you so much, Aya. And now we will move to a specific example from the Latin American region, where in response to the Zika crisis, and it looks like Maria Paula, I can see you, and can I hear you?
I hope you
yes.
can.
Perfect, yes, thank you.
Okay, very nice to meet you all virtually. I work in the UNICEF Regional Office for Latin America and the Caribbean, and I'm gonna try to explain you in 3 minutes how was our response during the Zika crisis and during the Zika virus when the virus starts spreading across the region. So the crisis was during 2016 and 2019, more or less, and during those years, the cases of children who were born with the congenital syndrome associated with the Zika virus was increasing very much. So because we know that the Zika impact has a very strong impact, not just on the child, but also on the caregiver, and an impact on all the family as well. So we did different responses, so we will be able to support the child, the caregiver, the family, and the community itself. And for that, one of the big responses that we did is to start using the Care for Child Development approach across the different countries where the Zika virus was more has a biggest impact on the children and the families. And the Care for Child Development was identified as a critical component for preparing multisectoral services and providers because it supports child development through early intervention strategies, strength responsive caregiving, assist families to address potential impacts, and promote inclusion and child rights. So one of the most complicated parts about the impacts of the Zika in the family was that many children were born with different type of disabilities. So in that sense, we needed to prepare the different frontline workers and the different sectors so they will be able to support the caregiver and the child. And in that sense, it was very useful for us to do the line and the big advocacy from national to local level using evidence-based. So we had first the Lancet, who was very clear about what we needed to do. Then it was the nurturing care framework who helped us to work across the different sectors and different actors and partners. And then we use the care for child development to go in detail and into actions to work directly with the different actors and sectors that needed to be involved. Because, of course, to respond to a public health emergency, you need to bring all the actors together. And in that sense, care for child development was very useful for us because it was infused into the existing services. So the frontline workers, what they did was they add the value of care for child development into their existing practices, and important components as responsive care into the nurturing care framework, they had more clear ways to do it. So the frontline workers, they knew how to work with the caregivers, so the caregivers will develop the different abilities that they need to respond in a positive and gentle way to their kids who were born, a lot of them with many different types of disabilities. It was also very easy to implement in health settings, including hospitals, and we started doing it since the prenatal visits. So it was key to work directly with the health sector. And of course, because we were talking about play and communication strategies, we strengthened the caregiver and child connection, so that helped us. So in the last couple of years after the child was born, the caregiver were more confident about raising their children and look for different opportunities, not just for the child to survive, but also thrive. Thank you very much. And I'm looking forward to respond to any questions that you have.
Great. Thank you so much, Maria Paula and Aya. Excellent presentations, lots of food for thought. I'd like to turn now to Sheila. And given the important global perspective you bring in all the work that you do, working with countries around the world, and the analyses that you do on the implementation of the nurturing care types of interventions, how do these examples reflect some of the challenges and opportunities you see occurring in other places around the world?
So I think, the framework, it was launched in 2018 alongside the World Health Assembly. And I think it came at a pivotal moment where people were looking for a way to talk about early childhood development that would move us beyond these traditional ways of thinking. And so through the examples we've seen today, we're seeing more engagement from the health sector than we've ever seen before, where the health sector is looking at what are the touch points that exist already through the routine services that reach families with young children, and how can those services be utilized in a slightly different way. So through the example that Maria Paula shared of how do we take those routine touch points and enhance those with a little bit more attention to aspects that perhaps traditionally have not been explored before. So how do we ensure that we are paying attention to the caregiver well-being? How do we look at what the interactions are between the caregiver and the child, and how we might use that time we have with the family to provide some recommendations or provide some encouragement that would allow them to go home and continue supporting their child's development. I think an example that Aya gave us, we're seeing this innovation around mass media, innovation around technology, and how do we leverage these different tools, especially now that everything is moving more and more virtually. How do we use those opportunities differently to communicate different messages that perhaps we weren't communicating before? Because I think what we're seeing is that there's recognition that there's already a lot of work that has been going on, particularly when it comes to health and nutrition. But the framework gives us this insight into there are things that are missing. There are things that we could be doing more, like giving attention to safety and security of the children and their families, looking at caregiver well-being, making sure that there are opportunities for children to learn at home or in centers, and looking at that interaction between the caregiver and their child, and how how that is functioning, because we're learning more and more about how the more that we can do right at the beginning, we all know this, those of us that are in this session probably already know this, I don't need to repeat it, but when we're talking about unlocking potential, we know that it starts at the very, very beginning, and we know that these are the moments when we can set children on the right trajectory, and we can address some of these issues that we are seeing today in fragile settings in particular, but around the world, where we can provide more hope, more opportunities for resilience and social cohesion. The challenges that we're seeing, though, are financial. Sometimes we're seeing in many cases that there's not enough money being allocated towards the comprehensive set of services. There might be pieces, but not that comprehensive set of services that would support the child and the family in the most comprehensive way. We're also seeing that policies and plans sometimes don't go far enough or as far as they could. It's changing. We're seeing a lot of countries in the world either revising or developing policies, and in the spirit of aligning to the nurturing care framework, they're taking into consideration what are these 5 components, what are the roles of different sectors or different organizations or agencies, how can we come together and work differently than we've done before. And so that's been really exciting to see that the framework has given people language. It's given people a sort of an organizing principle, a way to look at their work, either in their own organization or in a different context, and think about how do we move in a slightly different way that takes us where we are now and moves as it could be like the care groups, the nurturing care groups that World Vision shared, where you're developing new models and you're thinking about those 5 components very concretely in the design, or you're taking something like what Maria Paula shared and saying, well, this is a service, how do I adapt it so that it's done in a slightly different way?
Excellent. Thank you so much. And could you very briefly just talk us through some of the resources that are available and pictured here on this slide for those?
Sure. So there are many. I think if it's your first time hearing about nurturing care or the nurturing care framework, then please do take the time to read the framework itself, because that's what underpins a lot of this conversation. And you can find it at the website here at nurturing-care.org. You can also join the mailing list, and we send out newsletters periodically with updates on new resources, but also information about what's happening in different countries around the world. The examples that we shared today from Maria Paula and Aya, they come from this brief called Nurturing Care for Children Living in Humanitarian Settings, where we're spotlighting very much the issues around how do we move things forward, recognizing that in humanitarian settings, not enough attention is being given to our youngest children around the world. But you will also find on the website a number of different resources ranging from key messages to help you and all of us be aligned in what we are asking for, in particular from the health sector. You'll find country profiles that look at how countries are faring across the different components of nurturing care, as well as creating enabling environments for nurturing care. You'll find the Care for Child Development materials that Maria Paula referred to. You'll find examples of what's happening in different countries. You'll also find increasingly more resources, more videos, training materials, but we're also trying to really share what countries are doing around the world or what organizations are doing around the world. What are the lessons that we are learning so that we can each support each other and move forward together.
Great. Excellent. So I would invite everyone to think of their questions for any of the speakers, for any of us. But I can kick it off with a question from Maria Paula. Given the Zika experience and the current COVID-19 challenges, what's your advice on what countries and humanitarian actors should do now to be better prepared for when a next emergency presents itself? And let's keep answers really brief so that we can open it up to the audience as well.
Perfect. No, I was just thinking about 4 main things that maybe can work. The first one is always evidence-based, that we have in the case of the nurturing care framework, we have the strategy and we have care for child development as the operational tool who make us the things go very easily, go back to the roots and the families and the frontline workers. And I love the examples that our colleagues from World Vision were presenting, because it's exactly that, no? Like to use it. I think it's important to build in what already exists. So if the frontline workers and the sectors are doing things, how we can add value in what they are already doing. And in emergencies, that also happens as well. I think we all know and we are convinced, but we need also to put the caregiver on the center. So how we can support the caregivers too, not just services for the children, but the caregivers needs a lot of attention and support as well. And of course, combine actions. If we are very good doing nutrition programs, how we can add other sectors into that, and we can combine actors to work together. And I think if we have some of these key elements, we will be able to respond better and faster in this emergency, but also in the next ones. Thank you.
Excellent. Thank you so much. And Aya, I was wondering if you could give us an example of how Ahlan Simpson, or the programs you've been working on, responds to acute crisis contexts, potentially thinking of the example of the Beirut blast that recently occurred.
Thank you for the question. Actually, Beirut blast, I think most of us have heard about the unfortunate events, and basically thousands of families were basically in lack of any services or support over like a very short period of time. And in addition to everything that we're doing in terms of like responding to the crisis, whether we're working with refugees, we had to work with another like crisis that's basically people being displaced within their own city. And for that, we worked immediately with the government there. So we worked with the Ministry of Health. We worked also with the Ministry of Higher Education, who they came and they actually approached us saying like we're already like in discussions about partnerships with them. And as Maria Paula was saying, like capitalize on what's already existing. And then we created this ECD emergency kit where basically we promoted it with the government through social media and their direct services about how they can cope with how can they cope with the blast and then recover from it, and what can they do with their children and also for themselves.
Excellent, great. I would welcome anyone who has a question to please raise their hand. I've been reminded that we do have a hard stop in just a few minutes, so there's very little time. I'm seeing one question around how can we ensure nurturing care model and this multi-sectoral approach occurs in fragile settings. And this is an excellent question and something that we've all been working on and thinking about together. I would invite you to read the new brief that we've just released on nurturing care in humanitarian settings, and we can share that link. It was highlighted but it provides some concrete suggestions around the types of interventions that can be implemented in humanitarian settings. And we really focus on a range of options, so that there are some universal interventions that can happen that should be what all pregnant women and caregivers with young children receive. And then, of course, there are more sort of indicated or targeted interventions for those who may require more supportive services. And so we kind of list sort of a menu of options that need to be adapted according to the context and according to what the needs are and what's feasible. Any other questions? Or Maria, Aya, Sheila, do you have anything to add?
Katie, I just wanted to highlight what you were mentioning early, is that applies perfectly for the Zika crisis. Mm-hmm. Because even if we develop universal services for all children, because this brought into the table the need to support with a specific focus children and families with disabilities. So it's like how we can, I don't want this to sound bad, but it's in a crisis, we can also move some agendas, and that happened in the region. So like children with disabilities, because of the crisis, we were able to push the agenda for inclusive and rights for children and families.
We have a question from Philip. I think it's targeted for me. Since I mentioned the refugee camps.
Sure.
Basically, he's asking for an example of a nurturing care framework intervention, early onset of a crisis versus a more long-term intervention. So basically, as I mentioned, like any humanitarian response comes in a package. So there's a bunch of services that any humanitarian response have to provide. So when we're talking about an early onset of a crisis, there's a lot of, like, we would say there's a lot of home and shelter and wash and food and health. And added to that, which is something...
Sorry, I don't want to interrupt, but we have 30 seconds. So I think we can send more information. I want to thank everyone for their participation. This has been a really engaging conversation. Thank you, World Vision, for really starting us off so strong in those solid examples. And we really do want this to be a call to action for all of us who are participating in this call and the organizations in which we work to advocate for more investment in early childhood and nurturing care interventions in fragile settings. And please see the resources that Sheila shared. Thank you all so much. We look forward to continuing this conversation.